Can this diabetes medication cause bleeding as a side effect? Before we dive in, a quick note. This video is for general information only and doesn't replace advice from your GP or diabetes team. Always speak with your healthcare professional about your individual situation. If you're taking Mounjaro for type 2 diabetes, you might be wondering whether it could cause bleeding. It's an understandable concern, especially if you've noticed any unusual symptoms. Let's look at what the evidence actually tells us. Mounjaro, known by its generic name tirzepatide, is a dual GIP and GLP-1 receptor agonist licensed in the UK for treating type 2 diabetes in adults. It works by mimicking natural hormones in your body to help control blood sugar levels. It enhances insulin secretion when your blood sugar is high, reduces glucagon release, slows down how quickly your stomach empties, and helps you feel fuller. Here's the important bit. Bleeding is not listed as a recognized side effect of Mounjaro in UK regulatory documentation. And the medication doesn't directly affect your blood's ability to clot. It doesn't interfere with hemostasis, platelet function, or coagulation pathways. So the drug itself isn't causing bleeding. You might notice minor bruising at the injection site, but that's just a local reaction to the injection itself, not a sign of any systemic bleeding problem. It's typically mild and clears up on its own. Now, Mounjaro does have gastrointestinal side effects, which are actually the most common issues people experience. Nausea is very common, particularly at higher doses. Diarrhea and vomiting are also frequently reported. You might experience decreased appetite, constipation, abdominal discomfort, or indigestion. These gastrointestinal effects tend to be most noticeable when you first start treatment or when your dose is increased. The good news is they often settle down as your body adjusts to the medication. Whilst Mounjaro doesn't directly cause bleeding, there's an indirect connection worth understanding. If someone experiences severe vomiting, this can occasionally irritate the lining of the esophagus or stomach. In rare cases, this mucosal irritation might lead to minor bleeding. But this would be a consequence of the vomiting itself, not a direct effect of the medication. There's another important consideration. If you're taking anticoagulants, blood thinners, or NSAIDs like ibuprofen, you already have an inherent bleeding risk from those medications. Mounjaro doesn't add to this risk directly, but if you're experiencing gastrointestinal upset, it's worth careful monitoring. Speak to your doctor about how to manage these medications together safely. So when should you actually seek medical help? Contact your GP or NHS 111 if you vomit blood or material that looks like coffee grounds. If you notice black, tarry stools, which can indicate bleeding in your digestive tract, or if you're feeling faint, dizzy, or unusually tired, call 999 for emergency help. Any unexplained bruising or bleeding should also be reported to your healthcare professional. Beyond bleeding concerns, there are other symptoms that require urgent medical attention whilst taking Mounjaro. Severe persistent abdominal pain, especially with vomiting, could indicate pancreatitis. Sudden changes in vision need immediate assessment, and if you're taking Mounjaro alongside insulin or sulfonylureas, be aware of hypoglycemia symptoms, as your doctor may need to adjust those medications. If you do experience any suspected side effects, you can report them through the MHRA Yellow Card scheme at yellowcard.mhra.gov.uk. This helps regulators monitor the safety of medicines. Managing side effects is an important part of your treatment journey. Your doctor will typically start you on a lower dose and gradually increase it as prescribed. This approach helps minimize gastrointestinal symptoms. Eating smaller, more frequent meals can help. Staying well hydrated is important, especially if you're experiencing nausea or diarrhea. And keep all your scheduled appointments so your healthcare team can monitor how you're responding to treatment. Remember, everyone responds to medication differently. What matters is open communication with your healthcare professional about any symptoms you're experiencing. They can help you determine whether what you're noticing is an expected side effect or something that needs further investigation. To recap, Mounjaro doesn't directly cause bleeding, and it's not listed as a recognized side effect. The medication doesn't affect your blood's clotting mechanisms. However, severe gastrointestinal side effects could rarely lead to indirect bleeding, and this should always be assessed by a doctor. If you found this information helpful, please give this video a like and subscribe to Bolt Pharmacy for more trusted health information. And remember, if you're concerned about any symptoms, always speak with your GP or diabetes team.